Hi, my name is Corey. I'm part of Group 9 in Pharmacodynamics, and our drug assignment was hydrochlorothiazide, or HCTZ for short. You'll see it marketed around your pharmacy under the brand name Microzide, and it is a prescription diuretic, or water pill as some patients may refer to it, in the treatment of high blood pressure. You also see it combined with other high blood pressure medications such as lisinopril or losartan. Hydrochlorothiazide is indicated in the elimination of excess fluid and swelling due to heart failure, cirrhosis of the liver, chronic kidney failure, corticosteroids, and nephrotic syndrome. It's also indicated in the treatment of edema, but not quite used as much now due to loops being more efficacious. Hydrochlorothiazide is the second most prescribed antihypertensive medication in the United States today. It belongs to the benzothiazide group, more commonly referred to as the thiazide group, and the prototype for the thiazide group was chlorothiazide. That is not used as much today because of its low bioavailability. That is where hydrochlorothiazide was designed. The FDA in February of 1959 approved hydrochlorothiazide to be used, and you'll see it marketed or manufactured in your pharmacy by such pharmaceutical companies such as Mylan and Watson. And that sums up the introduction of hydrochlorothiazide, so I'm going to pass it along to Michael, who's going to talk to you a little bit more about the mechanism of action.
Thank you, Corey. Hydrochlorothiazide works by inhibiting the sodium chloride transporter on the luminal side of the renal tubular epithelium by binding to the chloride binding sites. Sodium cannot transport across and go back into the body and be reabsorbed. Therefore, more of it is excreted. Consequently, sodium, chloride, and water are also all excreted from the body. This decreases extracellular volume in the body, resulting in decreased cardiac output and renal blood flow. Hydrochlorothiazide acts in the distal tubule of the nephron. Hydrochlorothiazide is available alone as a tablet or as a capsule in three different strengths, 12.5, 25, and 50 milligrams. These tablets or capsules are taken by mouth and can be crushed and mixed with water for patients that have difficulty swallowing. And now, Michael Nixon is going to tell you a little bit about distribution.
Now, we know that hydrochlorothiazide is well absorbed at a variable rate from the GI tract. Bioavailability is around 70% plus or minus 5, with a reduction of 10% when administered with food. Therefore, it should be taken on an empty stomach to prevent time to maximum concentration increasing from 1.6 to 2.9 hours. Absorption is also decreased in patients with chronic heart failure, as well as renal and hepatic deficiencies. Its onset of action is around 2 hours, with a peak effect between 4 and 6. Protein binding will be somewhere between 40 and 68%, with a volume of distribution between 3.6 and 7.8 liters per kilogram, correlating, of course, with the dose administered as well as the concentration achieved in the body. Now, hydrochlorothiazide does cross the placenta, but not the blood-brain barrier, and it is distributed in breast milk. Nevertheless, it is not significantly metabolized. For more on elimination and excretion, let's go to Dr. Pribble in Kentucky. From Midtown, I'm Michael Nixon. Dan?
Thank you, Michael. The plasma elimination half-life for hydrochlorothiazide has been reported to be from 6 to 15 hours, and the drug is eliminated primarily by renal pathways. Hydrochlorothiazide is not metabolized, but is eliminated rapidly by the kidney, with more than 95% of the absorbed dose excreted in the urine as unchanged drug. In patients with renal disease, plasma concentrations of hydrochlorothiazide are increased and the elimination half-life is prolonged. Hydrochlorothiazide crosses the placenta, but not the blood-brain barrier, and is also excreted into breast milk. The adverse reactions associated with hydrochlorothiazide have been shown to be dose-related. As a result of the mechanism of action of hydrochlorothiazide, polyuria is expected and is the most common adverse effect. Cardiovascular adverse reactions such as hypotension, including orthostatic hypotension, have been reported, which may be aggravated by alcohol, barbiturates, narcotics, or other antihypertensive drugs. Dizziness, headache, paresthesia, restlessness, and vertigo have also been reported and may be caused by electrolyte imbalances. Hyperuricemia has been reported in up to 40% of men taking thiazide diuretics, and anaphylactic reactions are also a possibility after taking hydrochlorothiazide. Now Dr. Cottrell will explain some things you need to tell a patient who is taking hydrochlorothiazide.
Thank you, Dr. Pribble. The most common reason for patients to receive a prescription for HCTZ is for high blood pressure. It works by getting rid of extra fluid in your body, which in turn means less work for the heart. It may also be given for other reasons as well. This medication can be taken with or without food. It is often best taken first thing in the morning as it will cause the patient to use the restroom frequently. Taking this medication at night may cause sleep disturbances. If you happen to miss a dose, take it as soon as you think about it. If it's close to your next dose, skip the missed dose and go back to your normal time. Some common side effects of this medication include increased urinary frequency, dizziness, upset stomach, constipation, diarrhea, and feeling tired or weak. If you notice a skin rash, swelling, new bruising, or bleeding, or shortness of breath, call your doctor immediately. Also, alert your physician if intense joint pain occurs, as this is a sign of gout. This concludes our presentation, and we'd be happy to answer any questions you have.